Hi guys, I'm Miss Anibet Pamate. So, I'm going to talk about first the fluid and electrolytes, balance and disturbance. The level of electrolytes in your body can become too low or too high. This can happen when the amount of the water in your body changes. The amount of the water that you take in should the amount you lose. Or it is equal to lose or to take. If something upsets this balance, you may have too little water or the so-called dehydration, or too much water called also the overhydration. So our learning objectives are the compare metabolic acidosis, alkalosis with regard to cause, clinical manifestations, diagnosis and management. The also compare respiratory acidosis and alkalosis with regard the causes, clinical manifestation, diagnosis and management. And the last is interpret arterial blood gas measurements. So if we tackled about the comparing metabolic acidosis alkalosis with these regards, so acidosis refers to an excess of acid in the blood that cause the pH to fall below 7.35, and the alkalosis refers to an excess base in the blood that goes to the rise above, and it is 7.45. Many conditions and disease can interfere with the pH control in the body and cause a person's blood pH to fall or of healthy limits. So the next is comparing respiratory acidosis and alkalosis. Breathing too fast can cause a person to go into respiratory alkalosis. This occurs when a person's pH level is higher than 7.45, involves an increase in respiratory rate or volume, or so-called the hyperventilation. The last one is interpret arterial blood gas measurements. Arterial blood gas analysis is used to measure the pH and the partial pressures of oxygen and carbon dioxide in arterial blood. The investigation is relatively easy to perform and yields information that can guide the management of acute and chronic illnesses. This information indicates patients' acid-base balance, the effectiveness of their gas exchange, and the state of their ventilatory control. Interpretation of an arterial blood gas result should not be done without considering the clinical findings.
Instances, abnormally high levels of anions flood the system, increasing the anion gap about normal limits. So, next is the concept mastery art. Metabolic acidosis is characterized by a low pH and low plasma bicarbonate concentration. Nurses need to remember that anion gap is calculated primarily to identify the cause or pathology of metabolic acidosis. So we have the table: reduce or negative anion gap, the normal anion gap, and high anion gap. So anion gap without potassium is 8, and anion gap with potassium is 12. So clinical significance, hypoproteinemia. So normal anion gap of anion gap without potassium is 8 to 12. Then the anion gap with potassium is 12 to 16. Then the clinical significance is normal anion gap metabolic acidosis. Then high anion gap 12, anion gap with potassium. The anion gap with potassium is 16. So the clinical significance is high anion gap metabolic acidosis. So next is the clinical manifestation. So signs and symptoms of metabolic acidosis includes the headache, confusion, drowsiness, increased respiratory rate, death, nausea, and vomiting. So, peripheral, the peripheral, vasodilation and decreased cardiac output occurs when pH drops less than 7. So, additional physical assessment findings include decreased blood pressure and cold and clammy skin, dysrhythmias, and, and shock. So, chronic metabolic acidosis is usually seen with the chronic kidney disease. Next is the assessment and diagnostic findings. So, the arterial blood gas measurement are valuable in diagnosing metabolic acidosis. So, the cardinal feature of metabolic acidosis is decrease in the serum bicarbonate level. The hyperkalemia may accompany metabolic acidosis as a result of the shift of potassium from the cells. So later, as the acidosis is corrected, potassium moves back into the cell and hypokalemia may occur. So then next is the medical management. So in medical management treatment is directed at correcting the metabolic imbalance. So here, if the problem is result from the excessive intake of chloride, then the treatment is aimed at eliminating the source of the chloride. So, unnecessary bicarbonate is given. However, the administration of sodium bicarbonate during cardiac arrest can result in paradoxical and intracellular acidosis. So, hyperkalemia may occur with acidosis and hypokalemia with reversal of the acidosis and subsequent movement of potassium back into the cells. So, next is what is a hypokalemia and hyperkalemia? The hypokalemia is a low potassium level in the blood. The hyperkalemia is too much potassium in the blood. So next is therefore the serum potassium level is monitored closely and hypokalemia is corrected as acidosis is reversed. So in chronic metabolic acidosis, the serum calcium level are treated before the chronic metabolic acidosis is treated. So to avoid tetany resulting from an increase in pH, so in a decrease in ionized calcium, alkalizing agents may be given. So the treatment modalities may include hemodialysis or peritoneal dialysis. So in hemodialysis is a procedure where a dialysis machine in a special filter called an artificial kidney or a dialyzer are used to clean your blood. So, in peritoneal dialysis is a way to remove waste products from your blood when your kidneys can't adequately do the job any longer. So, this procedure filters the blood in a different way than does the common blood called hemodialysis. So that's all. Thank you. Assalamualaikum. I am Sulina Ed Sulaiman, BSN 2 Libra. So I'm going to discuss acute and chronic metabolic acidosis based bicarbonate deficit. So acute forms of metabolic acidosis most frequently the result from the overproduction of organic acids such as body keto acids or lactic acids. So in chronic metabolic acidosis often reflects bicarbonate wasting and iron impaired renal acidification. So, a low level of bicarbonate in our blood may cause a condition called metabolic acidosis or too much acid in the body. Metabolic acidosis is a common clinical disturbance characterized by a low serum pH and low plasma bicarbonate concentration. So, So, it is characterized by an increase in the hydrogen ion concentration and the systemic calculation that results in an abnormally low serum bicarbonate levels. So, it occurs when the body produces too much acid or when the kidney are not removing enough acid from the body. So, it can be divided clinically into two forms according to the values of the serum anion gap. So, an anion gap is a person in a person with a metabolic acidosis. The anion gap is calculated using the results of an electrolyte panel to help determine which disorders might be responsible for the acid-base abnormality. So, high anion gap acidosis are most often due to ketoacids, lactic acidosis, chronic kidney disease, or certain toxic ingestion. So, next is the normal anion gap acidosis. So, the normal anion gap acidosis are most often due to gastrointestinal or renal HCO3 negative loss. Then, so the anion gap refers to the difference between the sum of all measured positively charged electrolytes cations and the sum of all negatively charged electrolytes anions in blood. Because the sum of measured cations is typically greater than the sum of measured anions, there normally exists a gap referred to as the anion gap because blood does not carry an electrical charge. The anion gap reflects normally unmeasured anion phosphate such as phosphate, sulfates, and proteins, and plasma that increase the anion. By replacing the carbonate, measuring an anion gap is essential in analyzing acid-base disorders. So, next is the pathophysiology of the metabolic acidosis. So, and metabolic acidosis occurs when either an increase in the production of non-volatile acids or a loss of bicarbonate from the body overwhelms the mechanisms of acid-base homeostasis or when renal acidification mechanisms are compromised. So, normal anion gap acidosis is also referred to as hyperchloremic acidosis. Hyperchloremic acidosis is a disease state or acidosis pH less than 7.35 develops with an increasing in ionic chloride. Next is the high anion gap acidosis result from excessive accumulation of fixed acid. So back to normal anion gap acidosis results from the direct loss of bicarbonate as diarrhea, lower intestinal fistulas, ureterostomies, and the use of diuretics, early renal insufficiency, excessive administration of chloride, and the administration of parenteral nutrition without bicarbonate or bicarbonate producing solute, example, lactate. So, high anion gap acidosis occurs in ketoacidosis, lactic acidosis, the late phase of salicylate poisoning, urine methanol, and or ethylene glycal toxicity, and keto with starvation. The hydrogen is buffered by HCO3 negative, causing the bicarbonate concentration to fall. In all these instances,
Acute and chronic metabolic alkalosis base bicarbonate excess. Metabolic alkalosis is a clinical disturbance characteristic by a high pH and high plasma bicarbonate concentration. Metabolic alkalosis is defined as elevation of the body pH above 7.45, and metabolic alkalosis involves a primary increase in serum bicarbonate concentration due to a loss of hydron from the body. And then next, pathophysiology. A common cause of metabolic is vomiting or gastric sanction with loss of hydrogen and chloride ion. Other situations predisposing a metabolic alkalosis, those associated with loss of potassium, such as diuretic therapy that promotes secretion of potassium, and ACTH secretion as in hyperaldosteronism. And then next, chronic metabolic alkalosis can occur with long temperature diuretic therapy, vellus adenocarcinoma, external drainage of gastric fluid, significant potassium depletion, cystic fibrosis, ingestion of milk and calcium carbonate. And then next, clinical manifestation. Alkalosis is primarily manifested by symptoms related to decreased calcium ionization, such as tingling of the finger and toes. Tingling in hand and feet means tingling hand, feet, or both is extremely common and bothersome symptom. Chest tingling can sometimes be benign and temporary. For example, it could result from pressure and nerve when your arm is crossed under your head as you fall asleep, or it could be from pressure on nerve when you cross your leg too long. Then, dizziness means is a term used to describe a range of sensations such as feeling faint, woozy, weak, and unsteady. And hypertonic muscles. Hypotonic muscles means hypertonia is defined as an abnormally increased resistance prescribed by the examined to an externally imposed movement about a joint while the patient is attempting to maintain a relaxed state of muscle activity. And then next, assess and diagnostic finding is evaluation of material blood gases reveal a pH greater than 7.45, concentration greater than 26. Urine chloride level may help identify the cause of metabolic alkalosis. So, next, medical management. Treatment of both acute and chronic metabolic alkalosis is avoid correcting the underlying acid-base disorder.
Assalamualaikum ma'am. So for today, I discuss acute and chronic respiratory acidosis or carbonic acid excess. So respiratory acidosis occurs when the blood is overly acidic due to an excess of carbonic acid, result from too much carbon dioxide or CO2 in the blood. Respiratory acidosis can result from anything that interferes with respiration, such as pneumonia or congestive heart failure. So etiology, the respiratory centers is in the pons or medulla control alveolar ventilation. Chemoreceptor for PCO2 or partial pressure of carbon dioxide, and pH regulate ventilation. Central chemoreceptors in the medulla are sensitive to change in the pH levels. Epidemiology, the frequency of respiratory acidosis in the United States and worldwide varies based on the etiology and stage. COPD patients are more prone to develop this acid-base disorder. Patients are more prone to develop this acid-base disorder. It has also been noted that surgical patients are at a greater risk of developing respiratory acidosis. Pathophysiology, carbon dioxide plays a remarkable role in the human body, mainly through pH regulation of the blood. The pH is the primary stimulus to initiate ventilation in its normal state. The body maintains CO2 or carbon dioxide in a well-controlled range from 38 to 48 mmHg by balancing its production and elimination. The history and physical. The clinical representation of respiratory acidosis is usually a manifestation of its underlying cause. Signs and symptoms vary based on the length, severity, and progression of the disorder. So, patient can present with dyspnea, anxiety, wheezing, and sleeping disturbance. The evaluation, an arterial blood gas or ABG and serum bicarbonate level are necessary to evaluate patients with suspected respiratory acidosis. Other tests can be conducted to evaluate the underlying causes. The respiratory acidosis can be further classified as acute or chronic. So here's the treatment or management. Once the diagnosis has been made, the underlying causes of respiratory acidosis has to be treated. The hypercapnia should be corrected gradually because rapid alkalization of the cerebrospinal fluid or CSF may lead to seizures. Pharmacologic therapy can also be used to help improve ventilation. So here's the different diagnosis. So, botulism, bronchitis, diaphragm disorders, asthma, diaphragmatic paralysis, or obesity. And that's all. Thank you.
Acute and chronic respiratory alkalosis. So the respiratory alkalosis is a clinical condition in which the arterial pH is greater than 7.45 and the partial pressure of carbon dioxide is less than 38 millimeters mercury. As with respiratory acidosis, acute and chronic conditions can occur. Chronic respiratory alkalosis results from chronic hypocapnia, and decreased serum bicarbonate levels are the consequence. Chronic hepatic insufficiency and cerebral tumors are predisposing factors. So the is caused by hyperventilation, which causes excessive blowing off of carbon dioxide and hence a decrease in the plasma carbonic acid concentration. Causes include extreme anxiety, hypoxemia, early phase of salicylate intoxication, gram-negative bacteria, and inappropriate ventilator settings. The clinical manifestations that the clinical signs consist of lightheadedness due to vasoconstriction and decrease the cerebral blood flow, inability to concentrate, numbness, and tingling from decreased calcium ionization, tinnitus, and sometimes loss of consciousness. So cardiac effects of respiratory alkalosis include tachycardia and ventricular and atrial dysrhythmias. The analysis of arterial blood gases assists in the diagnosis of respiratory alkalosis. In the acute state, the pH is elevated above normal as a result of a low partial pressure carbon dioxide. Treatment depends on the underlying cause of respiratory alkalosis. If the cause is anxiety, the patient is instructed to breathe more slowly to allow carbon dioxide to accumulate or to breathe into a closed system such as paper bag. So the anxiety agent may be required to relieve hyperventilation in very anxious patients. Treatment of the other causes of respiratory alkalosis is directed at correcting the underlying problem.
Assalamualaikum. So my topic is about the mixed acid-base disorder. So when we say the mixed acid-base disorder, it is when the patient simultaneously experiences two or more acid-base disorder. So mixed acid-base disorder may be suspected on the basis of findings in the medical history, physical examination, serum electrolytes, chemistries, and the anion gap. So there are examples of the mixed acid-base disorder, which is the metabolic acidosis and the respiratory acidosis during pregnancy and the cardiac arrest. So the partial pressure of carbon dioxide level is elevated and the calcium bicarbonate level is decreased. So too much acid and too little base in the blood can cause an acidotic pH, and the result is combined the respiratory and the metabolic acidosis. So that for the compensation of the mixed acid and base disorder, compensation tends to normalize the pH. So any alteration in acid-base equilibrium and sets into motion a compensatory response by either the lungs or the kidneys. The compensatory response attempt by to return the ratio between partial pressure of carbon dioxide and the calcium bicarbonate to normal and thereby minimize the pH change. So for the blood gas analysis, it is often used to identify the specific acid-base disturbance and the degree of decompensation that has occurred. So in this blood gas analysis tend to measure the amount of oxygen and carbon dioxide in the blood. It may also be used to determine the pH of the blood or how acidic it is.
parental fluid therapy when no other route of administration is available. Fluids are given by IV in hospitals, patient, diagnostic, and surgical settings, clinics, and home to replace fluid, administer medication, and provide nutrition. For the parameter is pH. pH is 7.35 to 7.45. And then PCO is 35 to 45. And then PO2 is 80. HCO is 22 to 26. And then base excess deficit is positive 2. And then oxygen saturation is SaO2% or 94%. For the mixed venous blood is 7.32 to 7.40. Proportions with water. Pure electrolytes-free water can never be given by IV because it rapidly enters red blood cells and causes them to rupture. Kasi usually, ang mga post-operative patient is NPO, yan sila na nothing per RM or mouth. So, in order to continue their nutrition, to gain energy and prevent dehydration, they have to be placed on parental fluid therapy. So, initiation fluid for the purpose of nutrition through IV when patient cannot tolerate direct nutrition or yung through mouth